Alright, we're going to continue on with the human heart. We've got a huge heart model today. We've got the right atrium. It's the chamber, also called the room in the top half on the right side. How do you tell right and left? You notice where the aorta is? The aorta goes back to the left. So we start with right atrium. We have an auricle. Auricle is this finger-like thing that kind of hangs over the right atrium, and left atrium. These are the auricles. Then, of course, we have the left atrium, the chamber over on this side. And then we have the left ventricle. The ventricles are the lower chambers. We'll pull out here. Ventricle, left ventricle, right ventricle. We've got the apex, very tip, bottom of the heart is the apex. Then we have, if we take a look at what's coming off the aorta up here, we have a right coronary artery, left coronary artery, and the left coronary artery sneaks straight down in between the ventricles, interventricular artery, and the circumflex, which goes all the way around to the back. Circumflex artery. And we have a coronary sinus. That's the blood that drains the blood. That acts as a vein. The coronary sinus acts as a vein. So, other things while we're here, we're going to take a look at the valves. We have the right atrioventricular valve, also called the tricuspid valve. We have the pulmonary valve, goes to the pulmonary trunk, pulmonary artery. We have the mitral valve, otherwise known as the left atrioventricular valve. And then we have the aortic valve. And those are our valves. Then we have superior vena cava and inferior vena cava. Inferior vena cava, both of those are entering into the right atrium. And then we have the we have the ascending aorta going up, descending aorta, and the arch. And the arch of the aorta has three ones: brachiocephalic, common carotid, left subclavian. So it's the brachiocephalic, left common carotid, left subclavian. BCS. Then, of course, we also have on here the pulmonary trunk. It's coming off this right ventricle, pulmonary trunk, splits into left pulmonary artery, right pulmonary artery. Right pulmonary artery is tucking in underneath the aorta. And then we have the pulmonary vein coming in from the left, right here, pulmonary veins. Pulmonary veins for the right. And then we have the ligamentum arteriosum right here, connected to the aorta. And lastly, we have the chordae tendineae. Chordae tendineae are little strings that hold on to the atrioventricular valves. They hold it to keep it from parachuting inside out. And that's the part of the heart.